It can be so painful that you don't even get out of bed, you don't go to school, you can't go to work, you even miss that special party you've been planning for the past 3 months. Yes, it can be that painful. Not to talk about the embarrassment that comes with calling in sick every month at work just because of period pains. Unfortunately, this is what a lot of women have to go through every single month. Well, if that is your case or you know someone who experiences this, please watch this video and send it to them. It could just help someone. We'll be talking about what causes painful periods, the two different types of painful periods and the differences between them, what you can do at home to relieve this pain, and the right time to see your doctor. If this is of interest, so keep watching. Also like, share and subscribe to my channel. Do not forget to hit that bell so that you'll be notified anytime I upload a new video. So painful periods simply is a situation whereby a woman begins to experience some cramps, especially in the abdomen, lower abdomen, during their monthly period. I'm going to be telling you about the cause of dysmenorrhea, the two types of dysmenorrhea, the home treatment, things you can do at home to help relieve the pain, and also when it is the right time to see your doctor. So let's get started. Regarding the types of dysmenorrhea, we have the primary dysmenorrhea and the secondary dysmenorrhea. Now, regarding the primary dysmenorrhea, the cause is the release of prostaglandins. So in this situation, when the prostaglandins are released, they cause a contraction of the uterus. So this simply means that the blood vessel and the muscles of the uterus are kind of squashed. And when this happens, there is very reduced blood supply to the uterus. And remember that the hemoglobin in blood carries oxygen. So because there is reduced blood supply, there will also be a reduction in oxygen. So this causes a lot of pain. I hope that makes sense to you. So talking about this, we also have other causes. One is when a girl child begins to see her period before the age of 12. That's another thing that can lead to primary dysmenorrhea. It can be also caused by obesity and smoking. So let's also go ahead talking about things like family history. Yeah, they can also cause painful periods. Now, in the painful periods of primary dysmenorrhea, there is no pelvic damage. There is no damage, rather, to the pelvic organs. So even when you go for any form of investigation, you find out that the pelvic organs are fine. Next is the secondary dysmenorrhea. So in secondary dysmenorrhea, there is damage to the pelvic organs. So it could be infection of the pelvic organs or any form of damage. Now, in this secondary dysmenorrhea, you find out that most women experience it maybe in their 20s or 30s. In their menarche or their teenage years, they never had any form of painful period, and suddenly it starts. That means something must have prompted it. Now, in this situation, you find out that some women complain that the pain is not just in the abdomen, but they could experience this at their lower back or even the inner thigh. So this is a kind of pain known as referred pain. And when a person has a kind of heart attack, you notice that they have this kind of pain, whereby the pain is actually coming from the heart, but they feel the pain around their left arm. So it's called a referred pain. That is what these women experience. It's not that the pain really is in the abdomen, it's really in the thigh or lower back where they are feeling it. It's just a referred pain. So these are the symptoms that such women come up with. So in this secondary dysmenorrhea, there are causes. One of the causes is endometriosis. So endometriosis simply means where the lining of the uterus goes and implants outside of the uterus. So every month you see that these linings break down, bleed, and they bleed into the pelvis. So this causes a lot of pain and inflammation. The next is adenomyosis. So in adenomyosis, you find out that this endometrium, which are the lining of the uterus, now go and implant in between the muscles of the uterus. they also shed and bleed into the muscles of the uterus, thereby causing pain as well. But it is less common than the endometriosis. Now, next is pelvic inflammatory disease. Pelvic inflammatory disease simply means an inflammation of the pelvic organs. So these pelvic organs are inflamed, sort of. In fact, it's usually caused due to untreated STIs, that are sexually transmitted infections. When they are not properly treated, they could cause pelvic inflammatory disease. And this is one cause of secondary dysmenorrhea. There could be other causes like ovarian cyst and others. So that is it about the causes of secondary dysmenorrhea. So let's talk about the treatments. There are various things you can do at home to help you relieve this pain. So one of them is the use of exercise. Yes, I know you might be wondering, why should you exercise when you're having pain? But we are talking about doing gentle exercises. It could be yoga, floor exercises. You could just assume a position that is easy and comfortable for you. Just mild exercises. And how it works is that when you exercise, it helps to relieve what is called endorphins. These are feel-good chemicals. They sort of help to make you feel good. So even when you're feeling the pain, it helps to kind of help mask the effects. So that is why exercise is highly recommended. Next is the use of medications. So when it comes to medication, you have to consult your doctor to give you the right prescription. So I'm not going to give you any sort of prescription, but what is usually used are called NSAIDs, the non-steroidal anti-inflammatory drugs. So these medications, you can use them in addition with paracetamol to help control this pain. But it's usually recommended that when you're taking them, you should consult your pharmacist or medical doctor, because when it comes to NSAIDs, people who have gastritis, stomach ulcer, some kidney diseases, and other kinds of medical conditions, you might not have to take this, or you might have to take them just under the supervision of a qualified healthcare professional. So that is it. And then next is the use of hot water bottles. Yeah, hot water bottles, they really help. So when you want to use them, it's good you kind of get a lining or something to cover it so it doesn't give you any form of burns around you. So these are the things you can really do to help you manage this pain. Then, talking about the treatment, there are other ones which can be offered to you by your medical practitioner. One of them is the use of hormonal contraceptive pills. So these hormonal contraceptive pills help to really relieve the pain. And it is also good for people who do not want to get pregnant. So that is it. It's going to give you two things at a time. Next is the use of what we call the TENS machine. So this TENS machine is used even for women who are in labor to manage labor pains. Although there is not enough evidence to prove that it really works so well. But I think that for it to be used in labor, it's really safe and a lot of people use it. But that is what you can only use when you consult your medical practitioner. Definitely you can't do it at home. So when should you see your doctor? It's very important that you see your doctor if all these measures have failed. You've taken your NSAIDs, your medications, and it doesn't work. You've tried exercises and it doesn't work. You've tried using different kind of position, coiling up, doing other kind of things, and it's not working. Then it is really time for you to see your medical practitioner. Thank you very much for watching, and bye for now.